All right, everyone. This is Julie Halusky, your webinar chair for KHAM. Welcome. We're going to talk about how AI applications can be successfully integrated into day-to-day operations with Mike Laidlaw. And Mike is a healthcare revenue cycle consultant who is currently focused on bringing AI and other automated solutions to hospitals. Prior to consulting, he was an executive director of revenue cycle operations for a number of large and small healthcare systems. Mike holds an undergraduate degree in business from the University of Massachusetts and a graduate degree in health science administration from St. Mary's College and is a Lean certified trainer. We welcome Mike and we welcome you and look forward to your participation. Mike, take it away.
Thank you very much, Julie. As Julie said, my name is Mike Laidlaw, and I've always been on the revenue cycle side. So much of what we're going to talk about today is how it relates to patient access. We are going to talk about artificial intelligence and some of the applications that apply. I know there is so much information out there about how it's going to take over the world and how everything is going the way of the Terminator, but hopefully I can allay some of those fears. I've always been someone, in addition to being on the revenue cycle side, who has been interested in operations and how I could integrate automation with them. Back in the day, which is many years ago, I took all the programmings, COBOL, Fortran, BASIC, all those types of programs, and quite frankly, I hated it. However, I found that I was pretty good at helping design things. So in 1982, when Apple first came out, I had the opportunity to develop a physician's billing plan using an Apple II Plus, which I'm sure is now part of the Smithsonian, that had a 48K RAM and a 16K RAM expander, which today we couldn't run anything. So today, the agenda is I'm going to give you a non-technical definition of the AI applications, and these are the ones that have to do with patient access. The patient access functions that do and do not lend themselves to AI. Some examples of many uses of AI in patient access. Working with information systems to implement AI. AI vendors and what to look for when selecting a product. A slide I call zeros and ones, and that's kind of interesting. We'll discuss more of that. Let's talk a little about ChatGPT, which is a program, regardless of everything we're talking about today, that you can use in your day-to-day activities within patient access, and I can explain some of those. At the end, we have questions. And quite frankly, this is my first time actually doing a presentation. So if people have questions, we could save them for the end. But here we go. So the applications that I have found that are readily relatable to patient access are speech AI, which is composed of natural language processing and automatic speech recognition, AI vision, which is optical character recognition, as well as decision trees and robotics process automation. So what I'm going to do is give you that definition, and I'm actually reading from an article that I co-authored with somebody who is much more on the technical side, who has a master's, actually has a PhD in computer science. So the first application we are looking at has to do with speech AI. Speech AI is also known as speech artificial intelligence, and refers to technologies that utilize artificial intelligence to enable machines to understand, generate, and interact using human language. It involves two primary fields of study: natural language processing and automatic speech recognition. Natural language processing is a branch of AI that is focused on the interaction between computers and human language. It involves understanding, interpreting, generating, and manipulating human language in a way that is both meaningful and textually appropriate. This is what allows AI to understand commands, questions, or even write and generate human-like text. I'm sure we've all been in a situation where you are caught in that loop when you're either going by a voice recognition software or a chat. And the chat, regardless of what you ask it to do, when you start yelling agent or give me a live person, just gets into a continuous loop. The one nice thing about AI is you can program it however you want to, and we'll discuss that further. The second part of it has to do with automatic speech recognition. This involves a conversion of the spoken language into text. This technology is often used in applications such as voice assistants, transcription services, and any other application where the spoken language needs to be understood by a computer. AI vision, optical character recognition, refers to the application of AI technology, specifically machine learning and computer vision in the field of optical character recognition. Traditional OCR is a technology that is used to convert different types of documents, such as scanned paper documents, PDF files, or images captured by a digital camera. However, it often struggles with recognizing text in complex layouts or poor quality images. AI-enhanced OCR learns from the mistakes and the successes in recognizing text. They use machine learning algorithms to improve their ability to recognize text in a variety of fonts, colors, and layouts. Furthermore, by combining AI, OCR, and natural language processing, these solutions can not only extract text, but also understand the context and make sense of information like a human would. So if you would, from our perspective on the patient access side, this type of information, when cards are scanned or things like that, it can convert everything to a text, which then can be uploaded into your host system. Now, some of the things we want to talk about today, if you have Epic, which I use quite a bit, or Cerner, or the very large programs, some of these things may be embedded, but there are a number of systems out there that do not have. The other part that's been around for quite some time is what's called decision trees and robotics process automation. A decision tree is a type of predictive modeling. It uses a tree-like model of decisions and their possible consequences. Robotics process automation is a technology that uses software, robots, or bots to automate repetitive, rules-based tasks usually performed by humans. When used together, decision trees can provide the decision-making framework that guides the actions of the RPA bots. So I know that's a lot of words. Again, Julie has the presentation and the article that we've written. All of these definitions are there if you'd like to look at them. One of the things that I've always looked at is what functions do AI lend themselves to and which ones they do not lend themselves to. So one of them that I found first is looking at them, what they do not lend. So one thing, because it's all programmed by humans, it has a very difficult time handling unprecedented situations. So what do we mean by that? AI systems are trained on existing data and known scenarios. When faced with completely new situations or rare conditions that have not been previously encountered or adequately documented, AI may struggle to provide solutions or guidance. Human healthcare professionals can use their intuition, experience, and creative problem-solving skills in these types of cases. The second thing has to do with interdisciplinary collaboration. Well, this is working with multiple departments. And one of the difficulties you have is that AI, again, is programmed by a human person to do certain functions. So when there are multiple departments involved, it's very difficult for that to do. Another thing, and I've had all kinds of discussions myself, and I would hope as patient access folks, you would agree with me, that one of the more complex things that can happen is surgery. Now, I've talked to a number of companies who say we can do it all. However, having worked in hospitals, having worked in medical groups, you find surgery is one of the most complex and complicated things to do. Doctors have their preferences, not only in terms of instruments, they have their preferences in terms of the types of implants they might use, the types of catheters. You have different types of equipment that has to be done. So from my perspective, and you can argue with me, complex scheduling with surgery and some of the other ambulatory type surgery services, I find would not lend themselves to AI. So then we go to a situation about what does AI lend itself to? So I look at appointment scheduling, pre-registration process, eligibility and benefit verification, patient queries, and predictive analytics. So we look at the many uses of AI in patient access, and these are available today. So this isn't pie in the sky. I've seen them, I've used them, I work with people who've worked with them. From an appointment scheduling perspective, you can automate appointment booking, reschedule and cancellation processes. You can optimize schedules in real time, matching patient preferences with available healthcare provider schedules, thus improving access and reducing wait times. So the applications we spoke about earlier with all the definitions, the natural language processing, robotics and process automation, the AI OCR would all be used in this sense. Pre-registration, it can streamline the pre-registration and check-in process by automating the collection of patient information. And this can be done in 100 different ways. It all depends upon how you decide. You can also do insurance verification and eligibility, and you can update patient records. This is usually done through a combination of primarily robotics process automation, so it can go out and look at something, bring it back, and upload it into your system. I know many of the systems are very difficult when it comes to allowing people to do it, but with RPA, you can make a workstation a person and let it upload that way. The other thing too is that with pre-registration, it reduces the administrative burdens and the wait times and improves the overall patient experience. Again, using these three factors. One thing I've also found doing some scheduling is opportunities by using automation to reduce wait times or reduce the amount of abandoned call rates, which all dictate revenue as far as we're concerned. Eligibility, once again, AI systems can quickly and accurately verify insurance eligibility and benefits, thus reducing much of the labor effort that we've had in the past. It can also help patients understand their coverage and what their out-of-pocket costs are up front and collect them if necessary. AI digital employees are available 24/7, 365. So if the patient wants to make an appointment or cancel an appointment, it can provide information on services, can guide patients through the pre-visit process, answer common questions. But to me, one of the most important things it does is it frees up human staff to focus on more complex inquiries. So again, natural language processing, robotics as process automation. Many of us are involved with predictive analytics in terms of what's it going to do or what can we use it for. The AI can predict which patients are likely to miss appointments or cancel them. Healthcare providers can take proactive steps to reduce no-shows, such as sending reminders and scheduling follow-up calls. This can be done through RPA. And it can analyze trends in patient flow, predicting busy periods, thus helping patient access in terms of the scheduling. I want to walk through something that I worked on a few years ago, and this involved a call center. And one of the departments we took on was a breast health center. And we asked them, okay, so how are you doing it now? So every month they would get a listing from the system of a person who had a breast health service 365 days ago. And they would make outbound calls using volunteers, registrars, and technicians, and they'd do it from this listing. They'd also send out mail reminders. So once again, it was under one of these catch as catch can to determine whether or not a patient needed one, and it didn't capture everything. When we took it on, at the time I was using Epic, so they have what's called Schedule Orders Work Queue. And we were able to go in and program a extract based on the previous day's request to determine whether or not a patient needed to be scheduled for a meeting with. We could reformat the data and make outbound calls. At the time we used an outbound call service, who would then return it to a live agent, who then could make the appointment for the patient. We also developed a program that did a look back based on type of service that the patient had 366 days ago, to determine who actually needed to have the service. In this particular instance, using Epic and using RPA, if a call was not answered, we could then increment it in Epic to have it make another call in the dates that we determined. Now, in today's scenario, we'd run kind of the same thing. However, when it got to the point of making an outbound call, it would be self-contained. It would be done by a digital employee that would go out and ask the patient whether they wanted to make an appointment. They could make it all online and then update the system. So as you see, there's been an evolution in terms of technology from making telephone calls to using outside services and to writing software that would do that, and then being able nowadays to do this completely and totally electronically without anybody having a hand involved. One of the things I've been lucky with too, I'm not sure how many of you have this, is throughout my career I was able to have programmers working with me. I'm really good at the hardware side and what the visionary piece is, but I'm not very good at programming, and I never have been. So that was one situation where I always had other people I could depend on. One of the things that, and I'm not sure from your perspective, but it's been mine, is that you as patient access professionals are the subject matter experts, and you're also the drivers of the process. When I look at information services, their basic tenet or idea is they would like vanilla and please hold the bolt-ons. Now, we always know that they are having a host system that everyone would like to have something, so they're trying to maintain a larger system, and to the extent that we add things to it, they also have to be able to support that too. Going back in my career, whenever I asked for something, the answer I always received was no. Even back when we developed that program for the physician billing, the answer was always no from the guy who was doing the program. And eventually they'd think about it and go through it and then come up with it. The other thing is on the IS side, there's a lot of trepidation in terms of what impact is this going to have on their day-to-day? And what do you need in terms of that? Another thing, and I've had over the years, is that you are the subject matter experts. Because information services has a billing module that they help you implement, does not mean they know billing. If they have a module that has to do with patient access, that does not necessarily mean they know patient access. One thing I look at all of these AI types of things, if it works for you, then do it. And if it doesn't, do not do it. Because you'll be putting in systems that may or may not work. Working with IS, I think we'll all agree that collaboration is a key ingredient. So they have to understand what you need. You have to understand what they need. However, you have to look at it from your perspective in terms of what is this going to do for the organization. everything you hear nowadays is about how AI is going to replace people. And to a certain extent, it may, depending upon whether or not you want it to happen. One of the things that I learned early on when I was involved with lean theory and how you were able to implement Six Sigma is that Toyota never lays off their staff. They may lay off managers, they may lay off temporary, but they don't want to lay off their staff. They will repurpose them to other areas of the company, or they'll provide them training to go to other areas of the company. So this is one thing you might want to consider if you say, okay, I can replace a particular module of what we're doing using AI, but this is going to free up 5 people. For me, I never want to give up people anyway. So what other things can they do that will enhance your process? Now, if you have to eliminate positions and you can automate, this may be one way to do it. However, I would encourage you to find other things for them to do. And once again, as far as budget considerations, if that has to do with eliminating positions or scaling back, that's something else you can do. But overall, if you read the Wall Street Journal, you read periodicals, is that AI is not necessarily going to replace people. They may need to learn new skill sets. The other thing we found is that AI is customizable to your needs. My sister is a CIO, and she retired, but she always told me is that she could make it dance. You just need to tell her how you wanted it to dance. In other words, she could program whatever you wanted, but you needed to tell them what it is. One thing I found in working, especially with natural language processing and some of these other things, is that if you have scripts or you have dialogues that you currently use, AI can be programmed to say whatever you want it to say. It's available in multiple languages, in voices. You can have it be British, you can have it be Elvis, you can have it be you or me. So there is a large amount of different things you can do with it. It can send text, emails, reminders, it can refer you to hyperlinks. And I was talking to someone earlier today who said that their new product is on a smartphone. They just hit a hyperlink. It brings them to something that allows them to apply for a certain type of service. Another argument we get, and I'm sure you get it in patient access, is that, well, not everybody has the ability to do this. Well, being over 65, I went and I looked at it and I said, so if I'm 65, how many people have access to cell phones, have a computer, and have access to the internet? And what I found is that 92% of the people have cell phones, 73% have a computer, and 97% of people have access to the internet. So sometimes that argument may or may not hold water. And the question is, do you want to do something for the 8 at the expense of the 92, or would you rather have the 92? And again, AI applications are what you want them to be used for. It's amazing, just from what I've been working with, because I'm looking more towards how can I help patient access the revenue cycle using some of the new technology. But they're up to you to determine how you want to use it in your day-to-day operation. One of the things that we all have to look at, and I know we've all been involved in this, is AI vendors and what to look for when selecting a product or service. As far as the technology and expertise, you have to look at their AI capabilities. Do they actually do machine learning, natural language processing, and computer vision? Can they customize it to what you want it to do? And as I said earlier, what I've found in dealing with several companies is they can do it. So if you wanted to say something in a certain language, then use a language. If you have scripts, it has scripts. Scalability obviously relates to how much can you expand a contract. A big thing today, and I know recently they had a data breach, has to do with data security and privacy. We have to deal with compliance all the time. We also have data handling practices in terms of how they collect, how they store, and how they process data, and do they follow the best practices for data security. Integration and deployment has to do with ease of integration. Getting back to the information services, are these types of programs that we're looking to implement, how easy are they to implement, and how easy is it for IS to maintain them? And from a deployment perspective, you have to consider if they have cloud services, whether they're on-premise, off-premise, do they have hybrid deployment options that meet your organization requirements? One of the things we have a concern about in patient access is uptime guarantees. If something goes down, how long does it take to bring it back up? And we've all seen in the past where systems have gone down and it generally go to downtime procedures and start dealing with a bunch of paperwork. The latency refers to the response time to the solutions, especially in real-time processing, which is critical to patient access. Support and maintenance. What are their support offerings? Their availability, responsiveness, and technical expertise. When they have maintenance and updates, when are they going to do them? How are they going to do them? How is it going to impact your operation? I have seen, and I'm sure we all have seen, that sometimes we run into situations where they do it in the middle of the day, which isn't very helpful to us. As a cost center or as a unit of the total patient access operations, is what's their pricing structure? Are they charging you per minute? Are they charging you per transaction? How does that happen? What's the return on the investment? How is this going to help you? As I said earlier, I always looked at it as how much can we speed up the processes in patient access? If I'm looking at scheduling, if I can reduce my abandoned call rate from 8% to 2%, what does that equal in terms of uptime? How many appointments are there? How much money can we get as a result of those new appointments? As always, we look at references, some of the success stories they have, case studies they might have done. We also go to other customers to determine how well they do. And one of the things that's been really big lately has to do with the ethical considerations in terms of the use of AI. Are they following the industry-wide practices in terms of being ethical? They must be committed to an ethical principles, including transparency, fairness, and accountability. You also have to consider any potential negative impacts that it might have on society. And as you've known, we've all seen this in some of the bias that can be written into these programs. I call it zeros and ones. And this has to do with the world's not going to fall apart. When we're looking at things that relate to patient access, we're not looking at deep fakes, AI weaponization, because that's not part of what we're doing every day. And it should not be an issue. Human beings develop and program AI. It is not something that's magic. Somebody is sitting there doing coding. And how they code it is going to, the dependence is on what they code. One of the pitfalls we find, especially on our side, is a lack of trust. We have a concern about the accuracy and the reliability of AI systems. As we said before, we oftentimes end up in a situation where we're asking for an agent or asking for somebody else. One of the programs I've worked with, as soon as you say agent, and it will actually prompt you at the beginning of the discussion, if you want to speak to a live person, just say agent. And as soon as it says agent, it's programmed to automatically do it. I know we've all gotten into loops where it just never stops, but you can't actually program it to do that. Trust is crucial in healthcare, and any perceived lack of reliability in the registration processes can affect patient confidence and satisfaction. The bias and inequality, which we just discussed, is AI algorithms can inherit biases present in their training and in programming. People program it. I know recently there's been a number of situations where people have said that it's biased with one person or another group, or it's biased in how they present things. So it's really something that you have to look at when doing this. Getting back to an earlier discussion, the compliance, ethics, privacy, and security. How does it all relate to what you're trying to do? One thing you can do today is there's a program out there, and there's many of them now, but the one I've kind of played with is ChatGPT. And there are other AI programs out there. From your perspective as a patient access leader, these can be a valuable tool for you on a day-to-day basis. You can go out and ask it, present an outline with these 5 things, and it'll just create it for you. You can create agendas based on what you want it to say. You can do performance appraisals, and you can have it filter down to what you want it to say. So if you say a person's in this particular situation and it brings something back, you can say, please expand upon that. It can help with emails. It can definitely help with research. And I'm using ChatGPT 4, which is a service you have to pay for. ChatGPT 3 is free, but ChatGPT 4 has something that's called an image creator. So I went out and I asked it, create an image of digital employees at workstation, and this is what it comes back. Well, this is what it came back with. So you can go out and create that. You can create almost anything. So if you want to do Christmas decorations or whatever you like to do, you can do it. It's also excellent for writing, and some people are good at it, and some people aren't quite so good at it. It'll help you with your language. I know my grandson has found that using the geometry program using ChatGPT is much better than what he was learning at school. So it can be used for that. So if anybody has any questions, I can answer them. Otherwise, feel free to contact me at my email, mk_Laidlaw@yahoo.com. My phone number, 408-888-6874. And I know that Julie has a copy of this.
Yes, I
as
do.
well as the article. And if anybody has any questions, please let me know.
Yeah, if anyone has a question, just go ahead and put it in the chat. I know that was a lot of information for us, but it was great information, Mike. Thank you so much. I learned a lot. Does anyone have any questions for Mike? We're going to have a copy of this webinar on our website, and then we'll also have the documentation out there too. Does anyone have any questions? Just open the chat and see if there's anything. Nope.
It's lunchtime, Julie.
I know. Well, everybody, I appreciate everyone joining us today. Thank you so much. Mike, KHAM really appreciates you coming and speaking with us today. And thank you so much. Thanks, everyone. Have a great day.
You're welcome.
All right. Bye-bye.
Bye-bye.